Senate Bill 1396 by Senator Wolk, an act related to the Inner-Coast Range.
Senator Wolk.
Thank you, Madam President. Colleagues, 1396 proposes the Northern Inner Coast Range Program to be housed at the Wildlife Conservation Board. The Northern Inner Coast Range includes all or part of 13 counties from Solano County in the south to the Oregon-California border to Siskiyou County in the north. It is the mountain range between the Central Valley and the coast. This area is the one that the Obama administration just named a national monument. The Northern Inner-Coast Range is an area of global significance, including world-renowned geological, biological, and cultural resources. It's an important part of the state's economy, provides substantial agricultural products, timber, water, and fisheries. 1396 creates an advisory committee to encompass all of the 13 counties, and furthers a collaborative effort that has been going on in this area between state and local partners. This was originally a conservancy, which has been transformed into and amended to become a program within the WCB, reflecting past actions with respect to conservancy formation. I ask for your aye vote.
Any discussion or debate? Senator Nielsen.
Madam President, ladies and gentlemen of the Senate, it's interesting that folks in most of these counties that would be affected don't want this. Many of the counties have formally taken positions in opposition. I would argue we do not need more conservancies. We've got 10 of them in California right now. We have numerous land trusts. We have the Williamson Act, and this national monument, so to speak, that has occupied so many hundreds of thousands of acres that has just been noted in this region, that it was also very roundly opposed, but imposed by the federal government on these counties. It takes so much more land off the tax rolls. And we've complained about that here, and we're complaining about it in the budget on the in lieu payments. Since 1949, parklands have been put off the rolls of our local counties, and they were supposed to get some money for that, for the lost tax revenue, and the state has not kept faith, and that's been an issue all of these years since. So now we're going to create more conservancies. We can't maintain that which we have, as the state has gained, for example, more parklands. Those parklands have not been sore pressed to be maintained. And I fail to understand the critical need of setting up, through the Wildlife Conservation Board, these additional conservancies. There was a strong concern that it was affecting the possibility or the likelihood, because of the support of the people of California, of Proposition 1, the construction of Sites Reservoir. Some language was put in that says that this would not affect Sites Reservoir. Ladies and gentlemen, this language is meaningless. It would not at all prevent things that would happen on all of the lands surrounding Sites Reservoir that would impede, if not absolutely stop, any construction on Sites Reservoir. And I submit the case of hundreds of landowners who produce profit or live around or farm around conservancies. I can name many in the district and the area that I represent. Very often, conservancies are not good neighbors, and they interfere with the individual landowners' opportunities to prudently and profitably manage their land. And I would argue that that's in the minds of some who are so enthusiastically in support of surrounding Sites Reservoir with more conservancies. And final argument, the counties that would be affected are not enthusiastically in support. They don't want this. And we don't need this. We have ample conservancy lands in California and land trusts to protect these lands. We need more? No. I urge a no vote.
Any further discussion or debate? Seeing none, Senator Wolk, would you like to close?
Yes, thank you very much. I would just like to close by saying this is not a conservancy. It follows the model that this legislature and governor supported with respect to the Santa Ana program that was set up within the Coastal Conservancy. And we are following that model, except not in the Coastal Conservancy, but in the Wildlife Conservation Board. This is very different than a conservancy with respect to the powers that reside in it. It is primarily an advisory program, an advisory group of the 13 counties to the Wildlife Conservation Board. And this particular program in and of itself does not have the power, and it's in the bill, to regulate land use, any power over water rights, any powers to regulate any activities on land. The 13 counties supported strongly the national monument. That is not what this is, and we have not heard from 13 counties who are opposed to this approach. Clearly, if that were the case, this bill will not survive the legislature. I ask for your aye vote.
Call the roll, please.
Allen? Aye. Anderson? No. Bates? Bell? Berryhill? No. Block? Aye. Cannella? No. DeLeon? Fuller? No. Gaines? No. Galgiani? Aye. Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? No. Jackson? Lara? Aye. Leno? Aye. Leyva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Mitchell? Aye. Monning? Aye. Morlock? No. Morell? No. Wynn? No. Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? Stone? No. Vidak? No. Wykowski? Aye. Wolk? Aye.
Call the absent members, please.
Bates? Bell? Aye. DeLeon? Jackson? Aye. Mendoza? Runner?
Ayes 24, noes 12. The measure passes. Colleagues, we're going to take several items out of file order to accommodate our colleagues who are serving on Budget Conference Committee. We will begin with Senator Hancock, who will present on two items, the first being file item 34. File item 34, Senate Bill 1279. Mr. Secretary, please read.
Senate Bill 1279 by Senator Hancock, an act relating to transportation.
Senator Hancock.
Thank you very much, Madam President and members. SB 1279 says that the California Transportation Commission will not allocate state funds for new projects proposed after January 2017 for the handling, storage, or transportation of coal at a port facility located in or adjacent to a designated disadvantaged community. The bill will not affect projects or infrastructure at existing port facilities. So existing facilities can receive funds to improve safety, rehabilitation, congestion reduction, modernization, maintenance of any of their rail terminals, yards, facilities, infrastructures, or right-of-ways. We've had many conversations, and the amendments we've taken to narrow the bill have removed the opposition of the railroads. Members, California's investments to contain climate change and grow our clean energy economy are significant accomplishments. It is in the state's interest to protect its commitment and continue to reduce greenhouse gases. Several years ago, California stopped using electricity from coal-fired power plants. Last year, we divested our state pension funds from coal. We should not use our people's tax dollars on projects and developments that undermine those steps forward and assure the people of California that their tax revenues and bond revenues will not be used to harm their environment or their public health. I would respectfully ask for your aye vote.
Any discussion or debate on the measure? Any discussion or debate? Seeing none, please call the roll.
Allen? Aye. Anderson? No. Bates? Bell? Berryhill? No. Block? Aye. Cannella? No. DeLeon? Fuller? Gaines? No. Galgiani? Glazer? Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? No. Jackson? Aye. Lara? Aye. Leno? Aye. Leyva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morell? No. Wynn? No. Nielsen? Pan? Aye. Pavley? Aye. Roth? Aye. Runner? Stone? No. Vidak? Wykowski? Aye. Wolk? Aye.
Call the absent members, please.
Bates? Bell? Aye. DeLeon? Fuller? Galgiani? Aye. Glazer? Aye. Nielsen? Runner? Vidak? Ayes 25.
Ayes 25, noes 9. The measure passes. We'll now move on to Senator Hancock's second bill, file item 39, Senate Bill 1110. Mr. Secretary, please read.
Senate Bill 1110 by Senator Hancock, an act relating to diversion.
Senator Hancock.
Thank you very much, Madam President and members. SB 1110 establishes 3 pilot projects for something known as the Law Enforcement Assisted Diversion Program, or LEAD, in which designated law enforcement officers, namely beat cops on the street, who contact a low-level offender engaged in drug use or prostitution, can offer that person at their discretion treatment and services. This is a pre-booking program, and if the person seriously engages in the program, prosecution is never instigated. Instead of the normal cycle of incarceration, booking, holding in jail, various other things, often release after a certain amount of time, this case management program provides a range of support services for the individual. The participant can engage in treatment, but ongoing treatment is not the only condition of participation. In 2011, LEAD was developed in Seattle, Washington. After 3 years of operation, an independent study in 2015 by the University of Washington found that LEAD participants were 58% less likely to be arrested after enrollment in the program compared to a control group that went through the usual criminal justice processing. It also found that the services cost less than the money for booking, court costs, and ordinary enforcement. LEAD is a public safety program with the potential to lower costs, have better outcomes, and safer communities. The pilot program has a sunset date of 2020 with a report to the legislature on what our participation shows for its usefulness for this state. I would respectfully ask for your aye vote and thank my principal co-author, Senator Anderson, for his help in putting this together.
Discussion or debate, Senator Anderson.
Members, I rise in support of this thoughtful bill. When you think about community policing, this is at the very heart of it. If we believe, and we believe the results that we're getting from community-based policing, then we ought to give as many tools in a toolbox to those police officers that are out there in the field. If they see somebody who would be better served in a diversion program, let's encourage them to use that diversion. If it doesn't work and they see that person out there the following week, they can take another course of action. But I think that we should give them all the tools possible in the toolbox and encourage them to do the right thing. And that's what this bill does, and that's why it's so important. I firmly believe in community-based policing because I think it has very positive effects, and I know that you do too, so I'm urging an aye vote. Thank you.
Senator Hertzberg.
Thank you, Madam President. Members, this bill makes my heart sing. I came back to this government for these years, among other things, with one purpose, is to make and do everything possible to make the judicial branch work better for people. And we know that young kids who otherwise get in the system, we see the adverse effects. We saw what was just expressed by the author, 58% less subsequent arrests because of this program. This is an important component to a much larger dynamic. I was fortunate enough to watch an 11-minute video that the author gave me that talked about and showed at a very human level the interaction between a police officer and somebody who had been on the street and had been subject to this program, and you could see it in their eyes. You could see the energy. You could see the effectiveness of the program. At the end of the day, we work in billions of dollars. We work in big numbers. We use all these fancy names all the time. But at the end of the day, this is about people. And this is about giving folks an opportunity to have a life and to stay away from this stuff. So, you know, I know that others have spoken. I appreciate that. But I was so impressed by the program, so impressed by the impact of seeing folks and what the individual impact was. I ask for your support of this important measure.
Senator Hancock, would you like to close?
I would respectfully ask for your aye vote.
Please call the roll.
Allen? Anderson? Aye. Bates? Bell? Aye. Berryhill? No. Block? Aye. Cannella? Aye. DeLeon? Fuller? Aye. Gaines? Aye. Galgiani? Aye. Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? Aye. Jackson? Aye. Lara? Aye. Leno? Aye. Leyva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? Aye. Morrell? Wynn? Aye. Nielsen? Pan? Aye. Pavley? Aye. Roth? Runner? Stone? No. Vidak? No. Wykowski? Aye. Wolk? Aye.
Call the absent members one time, please.
Allen? Aye. Bates? DeLeon? Morrell? No. Nielsen? Roth? Runner?
Ayes 31, noes 4. The measure carries. Colleagues, we're going to turn now to file item 10. Mr. Secretary, please read.
Senate Bill 10 by Senator Lara, an act relating to health care coverage and declaring the urgency thereof to take effect immediately.
Senator Lara.
Thank you, Madam President and members. Members, today we are poised to once again make history as we formally ask the federal government to allow undocumented immigrants who can pay into our exchange actually pay into the system. We know that the Affordable Care Act depends on having more people be part of it to succeed. And California has been the leader in ensuring that this federal program actually succeeds. But as we send this important message to Washington, we are not just sending it with a simple majority. The Assembly approved this legislation by 2/3 vote with bipartisan support, ensuring that we send a loud and clear and united message that, one, here in California, Democrats and Republicans can actually work together on sensible immigration policy. Two, that we are sending the strongest message possible by affirming with a 2/3 majority that in California, we're telling the feds to get their act together. Stop playing with the lives of some of our most vulnerable Californians. We made history, members, last year by ensuring that every child, regardless of their immigration status, have access to Medi-Cal. We have tremendously changed the lives of every child in California. Some of you have been with me throughout the state, meeting the families that have now don't have to worry about where they're going to come up with the money to be able to ensure that their children have access to care. We have seen that in the most powerful state in the union, one of the richest states in the union, people still forgo access to Medi-Cal, forgo access to health care because they're afraid of how they're going to afford to pay for this. This is unconscionable that this is still happening in California. And we do know that 30% of our undocumented community here in California make more than the level to qualify for Medi-Cal, so they can actually pay into the system without any subsidies, members, without any subsidies. These are people that want to have the access to seek health care for themselves and for their family. Why not let them do so? It is immoral to discriminate against a group of people simply for the fact that we're playing politics in DC. Today, we're going to send a strong message, members, that in California, we will hopefully become the first state in the union to obtain a waiver from the federal government to allow our undocumented community to pay into the Affordable Care Act, again, without any subsidies, members. This is out of their own money to be able to care for themselves and care for their families. Members, I ask you, let's make history again. Just like we covered our children and we sent a long message to Washington, D.C., that all California children matter, today we're saying, give us the opportunity to once again demonstrate that California is a leader, that California is at the vanguard of showing bipartisanship, of showing that we care for our most vulnerable Californians. I ask for your aye vote on SB 10, members, which again requests the federal government to give California a waiver and allow undocumented Californians with their own money pay into the Affordable Care Act. I respectfully ask for your aye vote.
Senator Cannella.
Thank you, Madam President. I rise in support of this bill as it builds on last year's SB 4 and is a reasonable step allowing a greater number of our undocumented immigrants to use, as Senator Lara said, their own money to buy coverage through Covered California, just like every other Californian. Experts tell us that 1 in 6 children in California have an undocumented parent, and 74% of households headed by an undocumented individual have mixed immigration statuses. This bill provides a common sense solution to provide health care services to our undocumented population. Far too often, those that do not have proper health care access rely on our emergency rooms to be treated for health issues, causing the state unnecessary costs. By increasing access to preventative care, we reduce the strain on our urgent care services and help make our communities healthier. It's important to note that SB 10 will not provide tax credits or subsidies. Those that will be able to enroll will pay with their own money in their own way. Undocumented individuals are already eligible to provide coverage using their own money outside of the Covered California system. In my district, we have many families with mixed immigration statuses where some family members are here legally and others are not. As the author said, SB 10 just lets every Californian who needs health insurance use Covered California as a means to buy it.
Senator Stone.
Thank you, Madam President. We all want to help as many people in the state of California as possible, but our constituents that are here legally still face many challenges. The author says it's immoral to use politics to play with people's lives. Well, what happened in appropriations when he killed a veterans bill that would have eliminated property taxes for 100% disabled veterans coming home from Afghanistan and Iraq who can't afford to pay the property taxes to stay in the homes that many are donated to them? So where is he with the people that put their lives on the line for this country and standing up for veterans? How about our tuition for our kids that are struggling with a lot of debt? One of my bills was killed in appropriations that would have given a tax write-off for our kids to help them get through school without a lot of debt. Or what about our seniors that struggle to stay in their homes and we can't freeze their property taxes when they're 65? Why aren't we using the resources that we have in the state of California to take care of the most vulnerable populations that are here legally?
Senator Stone, I'm going to have to ask that you focus
continue.
your remarks on the bill before us.
This bill
please.
puts 3 million more people into our health care system, and it will make it more difficult for everybody to see a doctor, and will raise costs for health care for everybody in California. California has a massive primary care shortage. Community health centers in rural areas, many of which I represent, say that it takes up to 2 years to recruit a health care professional. Since undocumented immigrants cannot receive federal subsidies, California taxpayers will be on the hook to pay for health care of millions of people who aren't here legally. If this bill passes, California would be the only state in the nation to provide such benefits for non-citizens. The result will be that California shall become the magnet to attract more non-citizens from out of state in need of health care coverage. If this bill should become law, there will likely be no federal funding for either subsidies or policies and plans purchased through the exchange, nor will there be likely federal matching funds for the state's expansion of Medi-Cal benefits to illegal immigrants. California taxpayers members are already overtaxed. Over 1/3 of our state is on Medi-Cal. This bill will only make things worse for everybody. Let's devote our resources to those that are legally here that are suffering. Veterans, students, and seniors, I urge a no vote.
Thank you. Senator Hernandez.
Thank you, Madam President, members. First of all, let me just take this opportunity to thank the author for his leadership role on this issue with regard to immigrants, and especially with regard to health care for all with the children. I believe that health care is a right that all of us should have in this country, but in particular here in California. And if you look at those individuals that come here to California, they're here to work, they're here to make a living, they pay taxes, and they need access to care. So let's first talk about the economics of these individuals who don't have access to health care and the cost to our system. Well, guess what? They're more likely going to wait to the last minute because of chronic disease and use the most expensive system that we have, which is our emergency room. Well, guess what? That is going to be offset by the taxpayers. They're going to be less productive. So there was a comment made that there's 300 new individuals into this healthcare system. Well, let's talk about those 3 million new individuals into this healthcare system. Well, if that's truly the number, and those individuals get access to healthcare, which, by the way, there's no subsidies. The only thing this bill is going to do, it's going to allow the federal government to let these patients purchase health care in the exchange. It's not Medi-Cal. It's in the exchange with their own money and absolutely no subsidies from the federal government or the state of California. Now, let's take that population if we capture them at the right time. It's a younger, healthier population. Guess what that's going to do to the economics of the exchange? It's going to spread the risk. You're going to have more patients in there. Guess what? The state of California and the consumers are going to pay a lower premium because you're going to have more of a large buying pool, and it's going to benefit the state. Taxpayers aren't going to be paying for this. Taxpayers are going to win by having more individuals into our healthcare system. they're going to be purchasing insurance on their own. This is a win for the state of California and a win for the country, and that's why I respectfully ask for your aye vote.
Thank you. Senator Bell?
Yeah, 15 years ago, Santa Clara County was the first county in the United States to establish our Children's Health Initiative, which provided access to our Santa Clara Family Health Plan for undocumented children. And what we found out when we did that plan is we found a very interesting thing. We were able to get the children into health care. At the same time, we still had their parents going to the emergency rooms. That is not family health care as we should establish it. It's much better to have the family be able to go to a family doctor and avoid the emergency room. If you can avoid the emergency room, I like to point out, usually it was the public hospital or Valley Medical Center, public hospital. I want to point out that the emergency room at Valley Medical Center, when somebody walks in there, it's funded by the taxpayers when they walk in that emergency room. It's much better to have a health plan and the Covered California plan be able to be accessed by the families so that they can purchase on their own with their own money to buy the health care, as Senator Hernandez, Senator Lara have explained, than to have the taxpayers pay for the emergency room costs, which are much, much more expensive. So when you argue the fiscal side of this, I like you to consider that we are trying to cut the cost of our emergency rooms, and this is a very strong way of doing this. This plan that Senator Lara has proposed will allow people to purchase with their own money health care at no subsidy, as opposed to right now where the health care is provided by public hospitals at the cost of the taxpayers of California. This is good for the taxpayers. It's good for our community. It will provide better health care for people. I urge and I vote.
Senator Hueso?
Thank you, Madam Chair. I rise in support of this very important measure. This measure is important for all of Californians, not just the population that's mentioned in the bill. It's best to manage disease, to manage sickness in a society when everybody is receiving health care. We have a population in our state that many people would rather ignore, would rather not acknowledge, would rather simply say they are not from here, they don't belong here, but yet they are holding up, and in many instances, the backbone of the workforce of this state, providing for the labor that makes it possible for a lot of us to eat the food that we eat and to go into buildings that are clean, to receive lots of services from these workers in the restaurant industry and every part of the workforce sector. These are people that are actively participating in our economic system and providing so much to it, yet they don't have access to very basic human needs, sometimes not even clean drinking water. This is not only a humane bill, but this bill makes sense in every sense of the economics. It's going to make health care cheaper for everybody. As people pay in to the health care system, it offsets the cost of providing health care to everybody in that system. If they're not paying into the system but receiving services from the system, oftentimes through emergency rooms, they're much more expensive. Through emergency services, they're much more expensive. They're driving up the cost of the healthcare system currently as it stands today. This bill is going to reduce costs, but more important than money, it's going to provide health care to people who deserve it. These are human beings. These are our brothers and sisters. Let's ensure them. Let's make sure they have health care in this state. We are the wealthiest state in the entire world. This is the most prosperous country in the entire world. We can afford to do this. This is the right thing to do. Let's do what's right by our brothers and our sisters in humanity. please vote yes.
Senator De Leon.
Thank you, Madam President. This has probably been mentioned already. I got the short end of this debate on this issue, but by expanding the ACA, Obamacare, all you're doing is you're expanding the private market for those individuals who wish to participate, irrespective of their legal status in this case. So just to highlight a couple points very quickly, there is no taxpayer subsidy. There are no taxpayers paying in to subsidize an expansion of the private market in the ACA. So at best, perhaps it's illogical, the argument against quote-unquote illegal aliens, but at worst, it is intentionally perpetuating a myth for political points. Let me underscore so it's not ambiguous or vague. Perhaps the individual from Riverside is quite confused or hasn't had the opportunity to read the bill or understand and comprehend the complexities and arcaneness of the measure itself. There are no subsidies in this measure, and taxpayers are not on the hook directly or indirectly for the expansion of the private sector market of ACA. And it's been argued on a few occasions, just recently by the senator from San Diego and from Santa Clara, that with the current marketplace right now, that when individuals do get sick and they end up in the ER room, guess what? That's when we all pay collectively. So you make the decision. You pay now, or you pay a lot less, or you pay nothing later today. That's why this measure, SB 10, is not just the right thing to do, but fiscally for the state of California and for our taxpayers, it's the absolutely most essential thing to do.
Senator Leyva.
Thank you, Madam President. I rise in strong support of this bill. Members, we allow undocumented immigrants to do the worst jobs in society, and then we allow them to spend that money in whichever way they choose, going out to eat, buying shoes for their children, paying rent. Why would we not allow them the opportunity to spend their money providing health care for themselves and their family? It's their money. There are no subsidies, as you've heard. This only benefits society. I urge an aye vote.
Any further discussion or debate? Seeing none, Senator Lara, would you like to close?
Thank you, Madam President. I'd like to thank our members for this robust discussion. As we enter into Immigrant Heritage Month, I thought it was very fitting for us to have this dialogue. Again, many of us talked about how this is an economic benefit to California. And just to remind our colleagues that we spend $1.4 billion on emergency room care every year. $1.4 billion. Why not use that money in a manner that is much more productive for us by allowing undocumented immigrants to pay into a system, getting them out of the emergency room and into a hospital, getting them out of those long lines where they don't need to be for a simple cold, instead of having them be able to see a doctor. This is not a handout, members. This is an opportunity for all of us. And I'm not going to fall into the outdated, obsolete rhetoric that we hear about immigrants. Instead, I'm going to focus and thank those Republicans that have joined me in this effort time and time again to demonstrate that California is different, that in California we work together to find common solutions to problems that, and to issues that in the federal government are still being used to vilify and tear us apart. We are sending a tremendous message today, members, that we can work together. And we're sending a message to our immigrant communities that they matter, that integration works, that having you be part of our society is something that is not only the right thing to do, but makes economic sense. We have done so much to ensure that our immigrants are integrated into our society. We know that it saves money. We know it is the right thing to do. And I just want to thank my colleagues from the other side of the aisle, both in the Assembly and the Senate, for having the courage to stand with their constituents and stand with our immigrant communities of California. I respectfully ask for your aye vote.
Mr. Secretary, call the roll.
Allen? Aye. Anderson? No. Bates? Bell? Aye. Berryhill? Block? Aye. Cannella? Aye. De Leon? Aye. Fuller? No. Gaines? No. Galgiani? Aye. Glazer? Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Hueso. Aye. Huff. No. Jackson. Aye. Lara. Aye. Leno. Leva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. No. Morell. No. Wynn. Nielsen. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. Stone. No. Vidak. Aye. Wykowski. Aye. Wolk. Aye.
Call the absent members one time, please.
Bates. Berryhill. No. Leno. Wynn. Nielsen. Runner.
Ayes 27, noes 8. On the urgency, ayes 27, noes 8. Assembly amendments are concurred in.